Hi, my name is Ryan McFarland, and I'm a physical therapist with Origin Rehabilitation. And I just wanted to take a minute to talk to you guys about how we approach physical therapy and how we think the rehabilitation process should look in general. So, in physical therapy, we like to focus on getting pain relief, then progressing into improving stability and mobility, and then ending with really making sure you're getting back to the functional activities and the things you want to do outside of therapy so you're back to feeling like your great self again. It can be tricky though with all the different allied health professions such as massage therapy, chiropractors, personal trainers. It can be hard to know where to start, especially if you've had problems in the past seeing a provider, whether it's physical therapy or chiropractic, and not getting the relief you want. So instead of thinking in isolation of I'm going to go see a chiropractor or I'm going to go see a physical therapist and struggling to know who to go see and when, and that being a limiting factor, we like to think of everyone as one unit that can kind of help complement each other. In the rehabilitation world, every different aspect, whether it's chiropractor or personal training and massage, can work together to really help get you the best pain relief versus looking at things in isolation like that. For example, we had a patient, Mary, referred to us who went to a massage therapist for some pain. The massage therapist was able to get some pain relief, help free up some mobility with some of the soft tissue work, but then we were able to come in and really help fine tune the strength and mobility and functional aspect of the activities to keep her feeling as good as she was feeling after the massages. On the other hand, but in the same train of thought, we had a patient, Bob, who was coming in for back pain, and we came to find out there was actually some neck pain contributing to that. So we referred him out to a chiropractor who was able to really help with some of that neck mobility as well, while we addressed the neck as well and some back stuff. And as a unit, we were able to really get him some longer lasting pain relief versus just seeing physical therapy, waiting a while, and then going to a chiropractor after. There's actually been studies done that show that the more modalities you incorporate and the more well-rounded care you get all at the same time, the better results you get and the more long-lasting the results are. So regardless of whether you see a chiropractor first or a physical therapist first, your provider will help work with you to determine what other modality will help be a good complement. So the bottom line of all this is that we rarely work in isolation in the rehabilitation world. It's much more therapeutic and helpful for you in the long run to get a mix of care based off of the collaboration between you and your provider and who they see fit to be a good complement. And so, as a whole, with all the different rehab allied health professions combined, we can help with pain relief, stability, mobility, and then getting back to that function with everyone's own personalized touch and professionalism on where they specialize and how that fits in. It's going to be very individualized and it's going to depend on patient by patient basis, but thinking of things as a unit that way versus isolation really helps get the ball rolling and helps get you better care overall. Hopefully that helps kind of explain how we like to approach healthcare in the rehabilitation process. And if you have any more questions about you specifically and something a little bit more personalized, we'll have our information on the screen and you can always reach out if you have any other questions. Thank you.